In this episode, I'm gonna help you differentiate between a hip flexor strain and a hip impingement and the first couple steps to fixing those injuries.
I want you to have the capability to fully move the way your body was designed to, right?
Jump overhead, I'll take you back to where my problems lie. In trouble, younger daughter done some that made my mama cry. Out to the heavens like I bless him, for I know he's lost. Caught in a trance and his manic depression settled in. Get up and get down, get up and get.
Hey, what's up everybody? I'm Dr. Evan Horschig and this is episode 46 of the Ask Squat U Show. Hope you guys are having a great week of training and you're crushing some big weights. Let's get to today's question.
Is there a way to differentiate hip impingement from a hip flexor strain?
All right, so today we're gonna be talking about differentiating the two common injuries to the front side of the hip, a hip flexor strain and a hip impingement. First, let's talk about hip flexor strain. Anatomy-wise, you've got muscles that run on the front side, two muscles specifically that form your hip flexors called your iliopsoas. Now, those muscles become strained and will become painful with two different tests, a stretch test and a resistance test. So first things first, let's lay down on a bench. If your pain on the front side of the hip is truly a hip flexor strain, you will have pain first when it's stretched. Now, one way that we can do this is just called the Thomas test. You're gonna lay on your back, and let's say it's the left side that's hurting. Let's grab the right knee, and you're just gonna lay all the way back and let that left leg go all the way down like this. Now, again, if this is the strain, if this is truly the painful muscle, it will be painful when it's placed on a stretch. That's one way that you can differentiate. Also, a muscular strain will often bring out pain when you put a force through it, when it's forced to contract, because that muscle is just injured when it was put on an excessive stretch. So when you bring your leg up like this, it's often easy to have a friend do this, but basically hold your leg up and try to force it down and see if you can hold it up there. If this is a muscular strain, that will be painful when trying to force it down. So that is a muscular strain. Now, what is the next one? It's a hip impingement. If we look deep inside your hip socket, your femur sits deep inside the hip socket, a ball-in socket joint. When the socket moves, the joint moves like that, a hip impingement describes where the femur runs into the front side of the hip socket. And that happens in deep flexion. So basically, if you perform a deep squat and your pain doesn't come out until that deepest portion, that's often a sign of a hip impingement. Now, a hip flexor strain will not bring out pain in the bottom of a deep squat because that muscle is being shortened. And a strain, again, is an elongation of the muscle fibers where they start tearing away a little bit. So that is the way to differentiate between a hip flexor strain and a hip impingement. A hip impingement will be painful in the bottom of a deep squat, whereas the hip flexor strain will bring out pain when it's stretched or there's a force put through the muscle. Now let's talk about some of the first fixes for that. Let's talk about hip impingement first. Now we've talked about the reason for that impingement is because the femur is not moving correctly deep inside the joint and it's running into the front side of the hip socket. So one thing you can do is to improve the capsular mobility through a banded joint mobilization. What we're gonna do is take a band, attach it to a rig, and you're gonna get it really high into your hip like this. You're going to then get a ton of pressure on the band pulling laterally. Now our goal with this is because the band is pulling on the joint really, really hard, it's pushing out to the side, pulling out to the side, and improving the lateral and posterior fibers of the joint capsule. It's a very thick fiber that crosses and basically encapsulates the joint. So from here, what we're going to do is push out to the side, and we're gonna squeeze our glute. So we're turning on those lateral glute muscles, externally rotating, and then we're gonna come in. Now, if you had this band not attached right here, if this was not pulling out laterally, this motion may bring out that hip pinching pain that you have on the front side, that hip impingement. But because the band is pulling so hard, this may now be pain-free. So what we're gonna do is we're gonna rotate between a stretch and externally rotation, squeezing my glute, turning those muscles on, muscular re-education, and then back. And we're gonna do this about 20 times. So it's squeeze, 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 keep that big toe down, and then back into a little stretch like that, back and forth. And what you're always going to do after performing maybe about 20 of these is you're gonna get up, take that band off, and always recheck. Remember, test, retest to see if that was effective at bringing out the changes you desire. So get back into your squat stance, squat down. Does that feel different? You should feel like you have less pinching pain in the front side of the hip after performing. Now that is just one area that you can help improve a hip impingement. Another reason that sometimes we get that sliding forward of the femur in the socket is because some of the muscles on the back side, like the glutes, the glute medius and the glute max, aren't working well in coordination with the rest of the body. So one thing I like to use during warm-ups is called the tippy bird or a hip airplane. This is something that Dr. Stuart McGill has talked about before in many of his books. If you guys know Dr. McGill, this is how it's going to look. We're going to put one foot down on the ground. We're going to tip forward as if my hips are the center fulcrum of a teeter-totter. So my head's gonna go forward, my leg's gonna go back, I'm going to tip forward. Now in this position, I'm then going to rotate up, rotate back down, and then back up. Now what I'm doing there is I'm steering my strength. I'm using my hip muscles to create a good pull and keep that femur centered in the hip socket. So as I go forward, right here, my glute medius and glute max have to turn on to keep my pelvis level so that I'm not impinging or falling over. And then from here, I'm rotating up, again pulling with those lateral glute muscles, back down, and then back up. So this is the hip airplane. And something like this, if you do maybe 2 sets of 10, you're gonna feel those muscles of the lateral hip working well. And when those muscles are working well in coordination with the rest of the body, it's going to impart more of a centralization of that femur in the hip socket, again, cutting down on as much forward or anterior translation of the femur in the socket, less room for impingement. So sometimes those two things can be coupled very well for helping hip impingements. Now let's go on to hip flexor strains. Now again, remember, hip flexor strain is often caused because we have that excessive elongation, strain of the muscle that's caused a little bit of that micro tearing. The last thing we want to do is stretch a hip flexor strain. So if you have pain with a stretch, the last thing I want you doing is jamming that hip flexor forward and stretching all those muscles that are injured, because that's just going to create more of a problem. The way in which we can create some of that initial fix is by doing soft tissue mobilization and a little bit of isometric strengthening. Now the first thing we're gonna do is grab a ball. You can grab a tennis ball, lacrosse ball, and you're gonna find that area. Here's your ASIS. Basically, it's the tip of your pelvis right here. You're gonna go just down into the inside. That's where your hip flexors are gonna run. And we're gonna lay on that and find that spot that hurts a little bit, not too bad, and you're just going to roll nice and slowly in that area. Again, find some spots that are a little tender and sit on them for a couple seconds. And we're maybe gonna do this for about a minute or two and then back up. So again, soft tissue mobilization to help improve a little bit of the pliability of some of those tissues and then back up. Now that's step one. Step two is going to be an isometric contraction of the muscles. So in early exercise mode of doing a lot of strengthening concentrically and eccentrically, moving with strengthening can sometimes be a little too much if it's an early strain. But in isometric contraction, where the muscles are contracting but there's no movement of the joint on top of it, can often be more easily tolerated and help you set up for a better rehab. What we can use is a band. Now this is just a circle band by TheraBand, but you can also use like a hip circle band where you're gonna put this around the feet. You're gonna get into this position right here, hands underneath your low back so that your back's in a good neutral arched position. From here, you're gonna brace. Now let's say it's my right hip flexor that's hurting a little bit. I'm going to kick my left leg forward and not allow any movement in this leg at all. From here, I'm holding for 10 seconds. Now because I'm not allowing any movement of this leg, there's an isometric contraction of this hip flexor, which because it's turning on, it's going to allow us to impart a little bit of strength stimulus on that muscle, but not too much to where it's going to create any symptoms. And then back. And I may do 10 of these for about a 10-second hold, and then back. And eventually you'll get to the point where you can start doing those on both sides, where we're getting a little bit of lengthening right there, but not too much. Holding, and then back. So that is step one for a hip flexor strain. You're gonna do soft tissue mobilization and you're gonna do isometric contractions. So that is it for today's Ask Squat You show as far as differentiating a hip flexor strain versus a hip impingement and some of the first steps you can take at home to help along with that rehab process. I hope you guys liked today's show. If you did, please like, share. Let me know in the comments what you want to learn about next week, and please subscribe to the channel. Until next week, guys, happy squatting.
They say that energy flows where attention goes, so I pay no mind. Why waste my time with all these negative cats scratching? So caught up in their egos, these people have lost.